Hi, this is part two of two nurse skin assessments by Karsten Bishop and Jenny Miranda. Uh, the While this is a popular topic for many hospitals and institutions that are going to this, it proved to be a very challenging topic to try to find research evidence on. Primarily, we use Synol for most of our articles. There was I think two articles were outside of that. Two nurse skin assessment gave us probably one decent article, and then a lot of trial and error of pressure injury or what have you to get us down to the articles that we were able to find. Of the four articles that I'm going over, Cooper 2013, evidence-based prevention of pressure injuries in the ICU. It was primarily a level 4 article because of the 10 to 40% average of pressure injuries in the ICU setting due to the patient's immobility, as well as all the different equipment that's attached to them. Just was going over the two nurses just had a better chance of missing pressure injuries. They did most of their assessments per shift change as well as the initial skin assessment. Salicki 2016 also was a level 4. That was 4 eyes within 4 hours, a quality improvement project to decrease hospital-acquired pressure injuries. That primarily dealt with the first 6 months, or prior 6 months to them changing. They had like 7 issues and 5 pressure injuries average per month. After the education and adopting the two nurse skin assessment, they were able to decrease to 2 months. They had 0 pressure injuries, but on the 6-month average, they had 18 issues reported and 1 pressure injury per month average. That was on a 26-bed med-surg unit. Let's see. Probably just for me, that was probably like the best article just dealing with your two nurse skin assessment. The only other topic is that they had also gone over like the increased training as well as like the two nurse assessment. So while it was primarily geared towards that two nurse skin assessment, it wasn't just covering, the research wasn't only with just the two nurses. There was also a lot of education prior to that. A little closer to home was Reardon 2012, Nursing Best Practice Reduces Hospital-Acquired Pressure Injuries in a MICU. That was a small article I found from Hershey Medical Center. It was, I guess they had 22 pressure injuries over a 6-month period. Then that's when they adopted it takes two motto for skin assessment. So nurses were going over the skin assessment together. And let's go with at the post 6 months, they had a total of 9 pressure injuries, and that was like 60% reduction in the amount of pressure injuries. So it was a level 4-5 article. The only problem was they can't just attribute it to the two nurse skin assessment, because they also did a significant amount of education, and then they had a monthly update of education, as well as they were instituting Never Turn Down a Turn. And so it doesn't just collaborate, the two-nurse skin assessment is the reason for that 60% decrease. They had changed several things with the education, the promoting the turning, as well as the two nurses skin assessment. With not being able to find that many or any articles for myself of like a level 1 or 2, I went by association of 2 is better than 1. A mandatory second opinion reduces rates of unnecessary C-sections in Latin America. Apparently there's an average of 25 to 30% C-section rate in Latin America. In the hospitals that were in the article, it was an 18.9%. They ended up using 34 hospitals, 17 control and 17 like for the research, for 149,276 births. I guess the belief before the research would be that the second opinion would reduce that 25 to 30% rate by 25%. Post-study, it ended up with a reduction of 7.3%, and for an average of 22 of every 1,000 C-sections became a natural birth instead of a C-section. The data showed that about 96% of the time the second doctor agreed. I guess the limitations were that the hospital was able to set up the system for the doctors. It wasn't like a control by the study, as well as there wasn't any research to prove that the second doctor didn't just agree and actually did a full second exam. In conclusion, while the two-nurse skin assessment is a popular trend for preventing skin ulcers and being adopted by many facilities, the actual research per evidence-based indicates that we just need to do a lot more studies. There's very few, if any, level 1 or 2 like evidence-based research articles on two-nurse skin assessment, being actually better than a one-nurse skin assessment. It might be that they just believe that 2 is better than 1, but yeah, right now they just need to do some more research to prove that that's the case. And thank you.